Okay, we're back in business now, y'all. I'm fixing to go through some of the questions here and see what we have. Y'all see my fat belly? And see what we have so far over the lymphatic system. So one question that I missed during the lymphatic topic was, how does a client smoking affect treatments? Well, I mean, smoking is overall just toxic and bad for your body. You know, it dehydrates your skin. Will it interfere specifically with the body contouring treatment? No, it won't. And we have another question up here. Okay, Marie said, I know the contraindication is taking steroids causing swelling. Yes, oral steroids will always cause an issue with swelling. We should never treat a client that's taking oral steroids, and we'll get more into that when we discuss contraindications in depth. I'm curious as far as steroids that are not taken orally, such as nasal, systematically. So we're talking about like with the nose sprays, or if we have a client that has asthma and their inhaler contains a steroid, we are going to watch these clients very close. It won't always be an issue for treatment. It's going to depend on the client. We do, however, need to watch them for swelling, though. If we start to notice that there is swelling with the treatment, it's likely going to be due to even the small amount of steroid, but it's going to be a client by client basis. It's not an absolute contraindication like oral steroids. Oral steroids, you absolutely do not treat until 14 days after the last steroid was taken. So we'll watch them, but it's not necessarily, we're not going to do treatment with something like a medication that's like nasal, that, or, you know, asthma or something that they might be able to tolerate, they may not, depending on the amount of steroid that is in the medication. And this is going to be the same for hormone treatments, because hormone treatments also contain steroids of some sort. So these are all going to be things that we have to look at and monitor our clients really closely for any swelling. But oral steroid like prednisone, something like that, that's prescribed with it, prednisone is going to be an absolute no. Any oral steroid is going to be a no during treatment. Let's see. So we have here, so this is why non-invasive BBLs are temporary when we're talking about moving fat versus fluid. So definitely you can sculpt a butt and also use wood in combination with that to basically sculpt out the areas around the butt and give a definite change that will last for, you know, a period of time if the client maintains a healthy lifestyle. But the immediate result from the cups or moving fluid, no, that's not going to stay for a long period of time. As a matter of fact, most of that is swelling. And in order to actually make a muscle grow through cupping, which is the goal, because there's two things that makes a muscle grow, and that is blood flow and protein. Cupping provides a huge amount of blood flow to the muscle, which is why bodybuilders use it before competitions, because it really helps to pump up that muscle. But if you want to see some long-term muscle growth from a cupping treatment on the butt, then it's going to be a very long series of treatments, and they're also going to have to do their work at home. And it's not going to be a result that is comparable to like a surgical BBL. And you guys know that's one thing I've always been really upfront about is the butt the butt treatments with the cups. I feel like we have some people that are making that appear as something that it's not. And it's always best just to be upfront about what to expect, so that we don't have technicians out here thinking that they are failing at their treatments. I have some absolutely amazing before and after butt photos. I work harder for butts than I do anything, because it is not just as simple as slapping cups on the butt. It is a combination of cupping with virtual meso, with wood, with machines, with sculpting out the area around the butt. We're talking love handles under the butt, the insides of the thighs, everything around the butt that we can, because if you can change the way the waist looks, it's going to change the way the butt looks. And if you can thin down the thighs on the inside, that's also going to give a more lifted appearance to the butt. So these are all things that we're going to get into when we're discussing technique-based treatment. Let me see here. Scrolling down through the messages here. Want to know, at some point, will I ever do like a DIY Zoom class on making products only, like where we are just covering making products? I don't know that I would ever put that into an actual class. I don't feel like it's going to be absolutely necessary once the book. I feel like that the book is so in depth and covers things so much. It's got more pages in it than the Body Contouring Bible. You know, just to be based off products, I feel that it will cover it. I don't know that I'll ever do a class just on, you know, mixing and formulating only, because it's so, because there's so many different methods based off of what you are going to be working with and making. And I think that that's one thing where having something in writing is most beneficial, because there's so many different topics for you to look into and different formulas based off of what your goals are. Okay, so somebody had a question that said, what about, so you have a client that's a 7-year breast cancer survivor missing 4 lymph nodes on the right. So this is a situation where you're going to have a therapist, a massage therapist on your team that is specifically certified in manual lymphatic drainage, and this is why. She will most likely have to have a massage done following every second treatment. So it will be 2 treatments, massage, 2 treatments, massage, because once you get to that 3rd treatment, that seems to be like the magic number that kind of fills that lymphatic system up, where you'll really start to see some swelling from the treatments. So I would definitely recommend that. I don't know if I would only do 1 treatment on her per week, because really 72 hours is just not the amount of time that most people that we deal with need to be able to recoup from a treatment. I personally have seen better results with clients doing treatments once a week. So with a situation like that, I would definitely make it a requirement of treatment for her to see a manual lymphatic drainage therapist, and I would want her to go just set up on a schedule with them to have it done like every 2 treatments. Okay, Marie wants to know, I've heard you can use a percussive massage device in place of using wood. What are your thoughts on this? So I know exactly the device that you're talking about. And I think it depends on the setting in which it is being used. I would never say that I would think that that would replace wood therapy, just because I'm such a huge advocate for wood therapy. And I know how effective that it could, I know how effective it can be in sculpting. The percussive device is really good for stimulating the capillaries to open to receive fluid because of what it does to the skin whenever you're using it. However, if it's used too aggressively or at too high of a speed, it can do more damage than good. I really like wood because of its sculpting properties, but also because of the controlled environment that you can use it in. Meaning, you know, it's a manual treatment. So I personally, just due to how aggressive some of the electric devices can be, I personally, if I had to choose between the two, I would opt for the wood. Somebody wants to know about M-Sculpt for the butt. I do not offer M-Sculpt here. I've heard that it has really good results. The machine is expensive. I know it does wonders for the muscle. Electroporation on the butt is absolutely amazing because of the combination of Glutox and mesomuscle is very beneficial just for the overall look of the butt, and it really does help some with the lifting effect too. And then I think May wanted to know if you were referencing the G5. May, I'm not sure if when she was talking about the percussive device, if she's talking about the G5, you know, there's a couple of different ones. We've got the G5, which some people just really advocate for where cellulite is concerned. And then we have the device that has like the, well, I guess the G5 has one of the same attachments on it with like the little ball. So yeah, it would be, I think the G5 category kind of covers probably totally what she was talking about. So, and Marie said, yes, that was it. So moving on, before we get completely off of the lymphatic system, I want to kind of piggyback on this to go into the topic of cellulite before we discuss low-level light therapy. So when we are talking about fluid that sits in the body, people that retain fluid due to lymphatic issues, I just kind of want to give you guys an idea of some of the things that are in that fluid. So basically anything that is absorbed by the body is in that fluid. And due to the fact that we are constantly using so many different types of cosmetics and deodorants and things like that, I just want to kind of let you guys know, like one example that I'm going to give you is deodorant. We will talk about deodorant, which is actually so close right here, such close access to these main lymph nodes right here that have such a short distance to travel, you know, to be dumped over into the circulatory system where all of that fluid is basically moved throughout. It's passed through all sorts of organs in our body. So let's just talk about deodorant for a second as one idea of things that get put into the extracellular space, the free flowing fluid that the lymphatic system picks up. Okay, so number one, anytime a product is formulated for the skin, usually it contains a product that helps push it deeper into the skin. Some of these products are natural, usually not, because bigger companies, you know, have access to chemicals and things that we don't, synthetic things that are really beefed up to help push things deeper into the skin. However, When you have something like this in a product, it makes it to where everything that is in the product gets into the skin. And most all products that are bought in a store, even if they're advertised as natural, once you guys learn how to read the labels, you're going to find out what some of these chemicals actually are. And these chemicals are just a few of the things that go into this fluid that sits in your body. So we'll just talk about for a second the active ingredient in deodorant. The active ingredient in deodorant is anhydrous, and a lot of people are not familiar with exactly what the anhydrous chemical is, but it's actually used well, a couple of different things. So farmers use anhydrous a lot as a chemical for their crops. Another thing that anhydrous is used for is to manufacture methamphetamine. So anhydrous is one of the active ingredients in your deodorant. So we put the deodorant on. In order for the deodorant to be effective, it must go at least into the area of our skin where there are sweat glands. So we are in the territory of where we are crossing the blood barrier there and the lymphatic system. So the chemicals from this are not only, being put into this extracellular space here, there is also, access to where it could actually be mixed with some of the plasma in our body. And, actually mixed in with like the blood in our body before it ever even makes a trip on the lymphatic system. One way or another, we're either going to have immediate exposure to this, or eventually it's going to make our way through not only the lymphatic system, but the lymph nodes in our body. We all know that the lymph nodes are, if something touches the lymph node, it's basically going to be filtered through every area of our body. If it's on the lymphatic system, there is not going to be a part of our body that is not in some way or another exposed to what is in the lymphatic system. So a lot of what is in that extracellular space before it is ever picked up by the lymphatic system are chemicals and things that our skin has absorbed, things in the atmosphere, all kinds of things that we don't know that we come into contact with. And even though the skin is like armor, there is such a thing as molecule size. And certain molecule sizes can pass through the skin fairly easy. And that golden number is the 500 Dalton, because molecules are measured in Daltons. And anything that is a Dalton of 500 or below can pass through the skin fairly easy. And a lot of what is manufactured into skincare products, deodorant, shampoos, all these things that we use, most of those ingredients are below that threshold. So these ingredients are definitely making their way into this. I'm just kind of trying to give you an idea of what kind of trash is actually in this extracellular space. This fluid that your client is storing in one area, it's not just any fluid, it's a very toxic fluid. So when the lymphatic system cannot pick it up, a couple of things will happen. When it sets in that area, it becomes stagnant. And when the fluid, stagnant is when something just sits, it just stays there. It's just sitting. And as that fluid sits there with all of these toxins in this fluid, what happens is the environment becomes very acidic. And when an environment becomes acidic, when you lose alkalinity in an area is when things start to to become acidic. You aren't able to get things that you need in that area due to the acid content, as far as some of the oxygen rich things that you need to keep that particular area healthy. And one of the first things that will happen in an acidic environment is it will start to affect the tissue around it. Particularly, the first thing that you will see is that the connective tissue, which is the connective tissue, is the #1 source of cellulite problems. So the connective tissue is basically like it's like the glue that holds all of your body together, and it's like this webbing. Imagine like a cobweb. It's like this webbing. That is what connective tissue looks like. So when you have stagnant lymph fluid, which is a toxic acidic environment, any of the tissue or things around it start to become acidic also. And when that happens, nutrients are lost. And when nutrients are lost, particularly in the connective tissue, when it's starved of oxygen, nutrient-rich proteins, things that it needs, it will start to grow abnormally. And when this connective tissue starts to grow abnormally, it will anchor in certain areas. And when it anchors, we see that dimple-like effect. And when these areas become very acidic like that, they do not receive the proper amount of blood flow that they have. And you really need to understand why the blood in our body is so important, and why it is so important that every part of our body receives the blood that it needs at all times. For one, it's part of what keeps us alkaline. We are made to be an alkaline body. And the reason why is because we are actually, what we are powered by, our bodies as humans, we are electromagnetic, okay? Electromagnetic needs an alkaline environment. It needs an alkaline environment, and it needs certain minerals, particularly magnesium and sulfur. When this environment starts to become acidic, and we are not receiving some of these nutrients that are in our blood flow. Yes, Mary, that is correct. Is this why new clients experience itching after a couple minutes of vibration plate? Yes, and that is not a bad thing, because a lot of times that itching that they're experiencing is they're actually experiencing like a lymphatic movement. So that's not a bad thing. But when these areas become acidic, the first thing that will happen is it will affect the connective tissue. We will start to see cellulite. When we have an acidic environment, it is not receiving the proper amount of blood flow any longer. And there is a lot of things in that blood that we need. There are a lot of nutrients that are carried in our blood to these areas. And when that blood flow is restricted, then it just allows for things to happen to where we have now gone from, we had fluid here. Now the fluid has become stagnant. Now the fluid has become acidic. Now we are not receiving the amount of blood flow that we were to this area. So we are experiencing some abnormal growth with the connective tissue. We're starting to see some cellulite issues. But what follows that? What follows that is, over time, this connective tissue, if the fluid remains stagnant, it remains. Hey guys, hold on just a second. Okay, I thought I heard something in my wall. If the fluid remains stagnant and we continue to experience this abnormal growth, what will happen is scar tissue will form, okay? So now we have an acidic environment, we have scar tissue, and what grows in scar tissue and acidic environments? What grows there? Cancer. Okay? The lymphatic system is very important. All right? This is a chain of events that happens through that all comes back to lymphatic health. Okay? Fluid retention is not healthy. Cellulite is an indicator of abnormal tissue growth. There is an issue within that area. What is the first thing that we want to do to repair a cellulite issue? Okay, the connective tissue has to be healed. The connective tissue is the problem with cellulite. Cellulite is not a fat problem. Cellulite is a connective tissue problem. And a lot of times the root of that problem is stagnant lymph fluid. Either way, the first thing that we need to do is repair the connective tissue. How will you be truly successful in body contouring? You will be truly successful in body contouring because you understand the problem. If you understand the problem, then you can find out what fixes the problem, okay? So cellulite is caused by abnormal tissue growth. Why did the tissue grow abnormally? Stagnant lymph fluid, the area became acidic, and what happened? It stopped receiving blood flow. Why does that connective tissue need blood flow? What made it grow abnormally in the first place? The lack of nutrients that the blood carries. So what do we want to do to make that connective tissue better? We want to bring blood flow to that area. We want to bring that connective tissue some nutrients that it needs. It needs vitamins. It's starving to death. It's borderline fixing to grow into scar tissue. So this is why I'm such an advocate for vacuum therapy, the scraping method, which I'm going to show you guys for cellulite. It brings immediate blood flow to the area. You can treat cellulite with 10 million creams, but nothing is going to repair cellulite until you give it the blood flow it needs to heal. That's why it's so important to understand what causes these things. This is why theory is so important, because if you can get to the root of a problem and understand exactly how this stuff works, you can help make it better, easier. So we have another issue though, because not all cellulite is cellulite. Sometimes cellulite is not really cellulite. It is pockets of fluid. How can you tell the difference? You have one client who has actual dimples, the orange peel. You can see the dimples. When you go to grab it, it doesn't feel real jiggly. It kind of feels kind of tough. That is cellulite. That is connective tissue. Now we have another client that it's not dimples like anchoring points, but it almost looks like kind of like these little soft like bump things that almost give a dimple effect, but not quite. It almost looks like little fluid pockets. And when you put your hand on it really gently, and you just do your hand back and forth like this, it almost reminds you of holding something fluid in your hand. It's almost like you put your hand on a water balloon and you gave it a little shake. That is fluid. That is not abnormal connective tissue that has caused cellulite. That is not cellulite. That is fluid. True cellulite is anchored connective tissue that has created the orange peel dimple. That would be treated with rapid blood flow. That's what you want to treat that. If you can grab a client's skin, or not even grab it, you just put your hand on the client's skin. And if you can kind of do your hand like this, and it feels almost kind of like you're shaking a water substance, like it has a very watery feel under the skin. And another thing that you can do is the flick test, where you flick it, a couple of times really gently, and you'll almost see like a ripple or vibration under the skin. That is fluid. True cellulite will not present that way. So being able to look at cellulite versus fluid and know the difference, and a common place that I see people say this is up here on the upper abdomen, when we're taking pictures of somebody and you see like these little fluid pockets on the upper abdomen, and they're like, my client has cellulite on their stomach, how do I fix that? And you're looking at it and you see like these little fluid pockets in areas, and you're like, that's not cellulite. That's not a connective tissue problem. Cellulite is a connective tissue problem, but that is not a connective tissue problem. That looks like, that almost looks like fluid pockets. That's what it is. And that is a very, very populated area, lymphatic wise. It's not uncommon to see that there. And then once a treatment is done, it's like poof, it's just almost gone. And that is because it was fluid. There is a big, long article that I posted in the group that really, really goes in depth on this topic. It is fluid versus cellulite. This is something that is very beneficial to know, because you need to be able to identify the difference between fluid and cellulite. And understanding what cellulite truly is will help you with that. Because even though fluid retention causes cellulite, that doesn't mean that fluid pockets are cellulite, because cellulite is a connective tissue issue. It is where we have abnormal tissue growth that has created this orange peel, this dimple type effect. And you'll see all these tools for cellulite that has like all these big claws and stuff on them. And I can see where digging the crap out of your skin it's going to bring blood flow for sure. So yeah, I guess it'll bring some blood to that connective tissue. But being too aggressive with anything that has like fingers on it, you're also at the same time not being wonderful to your lymphatic system that is so delicate. Your lymphatic system is so delicate. It really needs to be handled gently. Vacuum therapy and cupping both are an amazing treatment for cellulite. If you don't have a cupping machine, one of the butt cupping machines, that's totally fine. You can use your vacuum handle on your machine to treat that as well. But vacuum therapy in general is a really effective treatment for cellulite in combination with radio frequency. Typically, I do not incorporate cavitation into my cellulite treatments, preferably, because usually my first goal is to heal the connective tissue. So I'm all about the blood and whatever will bring that first. But coming off the subject of the lymphatic system, I felt like it was good to just go ahead and move into cellulite and what is actually cellulite and what isn't. and why a certain treatment would help cellulite. People give you 10 million treatment protocols for a problem, but if you understand what caused the problem and you know what can fix the problem, you know what you need to utilize. You know what you need to utilize to do that. And a cellulite treatment will look very different than a typical body contouring treatment. Why? Because cellulite is not a fat issue. Cellulite is not a sculpting issue. Cellulite is not a contouring issue. Cellulite is a smoothing issue. It is a healing issue. It is, and it's going to take some time. People do one cellulite treatment and they're like, I don't see a difference. What did I do wrong? Well, shit, it has to heal. It took some time to damage it. It's going to take some time to heal it. Keeping fluid off the body is a wonderful cellulite prevention. Keeping fluid off the body is a wonderful cancer prevention, if we're going to be completely honest. Because I want for you to think about your breast. And how would you, Lord, I'm obviously holding some fluid in my breast, but how would you ever know if you were holding fluid in your breast? You wouldn't, especially like if you're kind of, you know, big chested like me. You know, women could have stagnant lymph fluid in their breast all the time and not even know it because we're so congested and toxic from all the shit we put in our armpits. And then we wonder why women are just ate up with breast cancer. I mean, vacuum therapy is amazing. Absolutely amazing. This is something that I really, really cover in depth. And I always drop it into every course I'm doing because I feel like I just want to spark that in somebody to look into it a little bit deeper. You know, people are, you see people that are doing the cups and things like that on the breast, and people are losing their mind and they're like, oh, you don't touch the breast tissue. What do you mean you don't touch the breast tissue? We've got to get that fluid out of there. We've got to, the breasts need to be stimulated lymphatically also. I mean, a lot, that fluid needs to be moved. We do not need stagnant lymph fluid in our breast. Why? Because stagnant lymph fluid does what? It becomes acidic. And what happens whenever it becomes acidic? It becomes starved of nutrients. And when it becomes starved of nutrients, what happens? Scar tissue forms. Can a tumor grow without scar tissue? No. No. Can a tumor grow in an alkaline environment? No, it cannot. A tumor can only grow in an acidic environment. Prevention is key. Love your lymphatic system. Keep that fluid off your body. Encourage your clients to stimulate lymphatically, not just for body contouring, but just as a whole, just because we love women and we want them to be healthy. The lymphatic system is the root. And I didn't mean to kind of get off like in left field whenever I'm talking about cellulite, but I'm trying to make y'all understand how cellulite happens, and also, you know, spark an interest in maybe, you know, the benefits of your own lymphatic system, and some things that maybe you might consider, you know, you've never really paid a lot of attention to your lymphatic system before, you know, but maybe understanding some of these things and just how science and the body works, you know, maybe you will, because lymphatic system is very important for body contouring. Successful lymphatic system equals successful body contouring treatment. You know, but it's also important in everyday life. So with that said, I knew we would be on the lymphatic system for a long time. With that said, on the lymphatic system, coming to a close on it entirely, I'm fixing to move on to another topic. Does everybody understand how the lymphatic system works? Some of the key points I want to make sure that are understood. Number one, the lymphatic system, the biggest majority of what we deal with is in the dermal layer of the skin, meaning that we can touch the lymphatic system, basically. Number two, the lymphatic system is very, very sensitive. You have to handle it with care. You cannot be aggressive with it because it's very easy to damage it. It's very easy to restrict flow to a lymphatic vessel. It's also very easy to damage a lymphatic vessel if you handle it too roughly. And although it self-repairs, it can create fluid retention issues. Okay? More fluid cannot go into the lymphatic system if it's full because the system is sluggish. If the system is sluggish, there's a reason. There is a reason why the system is sluggish. It's either hormones, a medical condition, a medication, something. This is why intake forms are so important. We need to not only know a little bit about medical history, we also need to know what type of medications our clients are taking, not only right now, but also within the past 30 days. That's why most of these forms say, what medications have you taken within the past 30 days? The lymphatic system is the number one source of a successful body contouring treatment, and stimulation is necessary. And it is not self-starting. It must be stimulated to move and to pump. And swelling is an indicator of sluggish lymph movement. These are all things that need to be understood. We can move fluid, not fat. We can move fluid, we cannot move a fat cell. That's another topic that I want to make sure that everybody understands that we covered in this. And then how long does it take to repair if collapsed again, a lymphatic vessel? It's all going to depend on the person and at the rate that their body heals. Some people could heal a collapsed lymphatic vessel within 72 hours, while, it may take another person 2 weeks. I know some people, it's also going to depend on how many were damaged. The circumstance of the trauma. If it's something post-surgical, oh Lord, it can take, it can take a long time for those to, I think they say post-surgical, within, it's like 3 to 6 months, the lymphatic vessels should heal themselves. I want you to think about something, y'all. I want you to think about how many C-section mamas do we see that for some reason in their lower tummy, they are just really puffy. They all complain about the same thing. They think it's skin, but skin is actually very thin, but they've got this like puff above their C-section scar. Think about surgeries and things like that where you're cut through there. All of those have suffered trauma. Some of them have been severed entirely and have to basically regenerate, which they do. But it takes some time. Think about this when you're, dealing with these C-section mamas, that are a year post C-section and they're still a little bit puffy around their scar there. And, some of that may very well be stagnant lymph fluid. This is why I say to end every treatment with vacuum therapy. Vacuum therapy moves fluid. Every treatment we do, what does it do? Every treatment that we do, even radiofrequency. People think that radiofrequency is just for collagen production. No, it's not. It also removes fat. It has the same capability as cavitation, but with a different power source. So yes, it's great for collagen, but it also reduces fat. So in order to reduce fat, what do you have to do? The fat cell's opened. What comes out of the fat cell? Contents. Where do the contents go? into the extracellular space. How can you clean up some of that fluid? And you want to stimulate the lymphatic system to open, to receive that fluid. This is why I will tell my students, I don't care what order you are doing this treatment in, even though I endorse heat it, break it, drain it, because that is an effective treatment for me. That is overall the best protocol that I've ever used. That's why I teach on it. But if you do, I don't care what order you do it in, as long as you use that vacuum last, you close it with the vacuum every time. And that's because you've got to clean up your mess. There is a mess in the lymphatic area there that needs to be addressed. There is a mess in the extracellular space that needs to be addressed. And guess what you can move? You can move fluid. You can't move fat, but you can move fluid. You need to move that fluid because you made a mess there. And if the lymphatic system will open and receive it, you need to put it onto the lymphatic system. That's part of completing your job, cleaning up your mess. So we are going to end lymphatic system entirely on that. Do we have any lingering questions over the lymphatic system that you guys feel like that I did not cover? Or is anyone not understanding really how the lymphatic system works or how it receives fluid? Now is definitely the time to bring it up so that we can discuss it live in a Q&A. Okay. All right. Well, very informal info. Thank you. Hey guys, thank y'all for rocking with me while I bounce all over the map. I'm sorry about that. I try to circle back. So we are going to, it's roughly 1:40 right now. I know that we are probably going to be discussing, we're fixing to be moving into low-level light therapy, and I already know that I'm going to be on that topic of, hold on. Wait, we have a question. What about dental surgery? Is it safe to perform treatment on a client who just had a root canal? It's going to depend on the type of medication they're on. It's going to depend on the type of medication that the dentist has them on. It's going to be more of a medication contraindication than, you know, surgical contraindication. Antibiotics. Okay. That's going to be, we want to wait a week, 1 week after antibiotics. We want to wait 1 week post antibiotics. So, that will be the only issue. So we're fixing to get on low light therapy. I know that I will be on that particular topic for at least an hour because there's so many things to discuss with low level light therapy. Because of that, we're going to go ahead and break for lunch so that I can start fresh. Everybody can get a bite to eat. I'm going to get a bite to eat. So we can meet back. Is 30 minutes good for everybody? Is 30 minutes sufficient eating time? We'll take a vote. Is 30 minutes good? Does anybody need an hour? Okay. All right. So we will just plan on being back here then at, it's 1:40 now, so we will pick back up at 2:10. Okay. I'll see you guys shortly.